A TPLO is a correct procedure for dealing with a ruptured cruciate ligament. So ruptured cruciate ligaments are very similar to what you see in hockey players and soccer players, where they go ahead and they move the wrong way and they basically can stretch or break the ligament within their knee. So dogs do this quite regularly. It's one of the most common orthopedic issues that we face. So the TPLO is a corrective procedure that can go ahead and stabilize the forces on the knee so that it reduces the pain and improves the mobility of the animal. So how dogs end up having to need a TPLO is after they've ruptured their cruciate ligament. It can be based on multifactorial issues, and it can start early in life or it can be more of a long-term overuse injury. But generally, we see two classes. We see them happening in young dogs around 3 years of age, mostly labs that are overweight, that have a genetic predisposition to cruciate injuries, and there are some DNA testing that is currently being studied to determine which breeds and even within those breed lines which dogs may be affected. However, there's also other factors such as excessive exercise at a very young age in certain breeds. Again, Labradors are one of those ones that are overrepresented, and also the amount of food if they're overweight. So being overweight can definitely contribute to the degeneration in those breeds that are susceptible to the disease. So we want to make recommendations based around diet, nutrition, staying lean, also the amount of exercise they're getting at a young age, as well as also the genetic factors. Two of them we can control, one of them that we can't. So we'll often see these young dogs 3 years of age that are rupturing their cruciate ligaments, and we would call that a degeneration of that cruciate ligament. And it's very common for them to go and damage one side, and then after 6 months it can be damaging the other side. So we'll see that happen in about 50% of cases. So it's really important to put preventative measures in place before it gets to that point. Unfortunately, we can't control everything. So dogs that are doing a lot of ball playing, they're playing rough and tumble, or even just walking in the backyard can get these degenerations within their knee at a very young age. Then the kind of second class that we see are the older, more geriatric dogs, or even just older dogs that are just running and it's more of an acute trauma where they move the wrong way and they tear that ligament out of kind of a misadventure accident rather than it being a degenerative problem. So those more acute injuries, we don't see a lot of osteoarthritic changes within the knee, and so TPLOs are there to kind of correct these issues. So generally when we see a patient for the first time that we suspect a cruciate injury, they're coming in because of lameness. And either it can be like a progressive lameness or it can be an acute lameness. And we'll do an orthopedic exam on them. So we will go ahead and we'll evaluate from basically their toes all the way up to their hip and kind of isolate where we're finding that there's pain. There's a couple different tests that we do when they're in for their initial exam. One is called a tibial thrust test, another one is called a drawer test. And we determine, okay, is there, signs of pain within that joint? Can we detect effusions by palpating the joint? Can we even feel, more chronic changes within the stifle joint itself, or the stifle joint being the knee joint? And once we determine that, yes, this is, the isolated area, their next step is going to go and do some radiographs to confirm our suspicions, and usually we'll see that effusions and changes within the joint, and then from there we'll have a discussion with the owner about what the best treatment plan is. Unfortunately, in the majority of cases, surgery is the appropriate treatment. There are some schools of thought where if they're under a certain weight and they have a partial tear, that we can go ahead and we can delay surgery and see if they're able to recover and do well on themselves. But those dogs need to be under 20 kilograms for us to make that recommendation. Any dog over 20 kilograms, surgery is the #1 treatment. There's always financial constraints. These are, expensive surgeries. They're prolonged recoveries. They can take up to 12 weeks for full recovery, but their prognosis is excellent. Whereas if we do a conservative approach, their prognosis can be from fair to good to poor. And when it becomes poor and we have more osteoarthritis, then we're limited in the future about what treatments are available, and a lot of those become medications that they're going to need long term. So once we make our diagnosis, we'll have a discussion with the owner and we'll make our recommendations. And in the cases where we feel a TPLO is the best advantage for the dog moving forward, for its ability to be mobile again and retain most of its function, most of these dogs recover to 95 to 98% versus other surgeries or other conservative treatments. So what we do is we will recommend the TPLO. We base that off of our preoperative x-rays, and then we'll discuss the plan with owners. So a TPLO involves making a circular cut in the bone that changes the angle and the forces that are acting on the stifle joint. And we use a bone plate that we put in with screws to stabilize that once we do a rotation and level off the tibial plateau. Once we do that, animals are, restricted for a period of time up to 12 weeks with, exercise and physiotherapy, pain medications, anti-inflammatories, and we will see them every 2 weeks back for post-operative rechecks, and then at 12 weeks we'll take post-operative radiographs, make sure everything's healed again, and then we'll advise the owner at the appropriate time for them to resume their normal activities. Again, the TPLO is the gold standard at this point in time. There's a lot of different discussions about what the best surgical technique is, but not every animal is suited for a TPLO, so there are cases that we want to make sure this is the right procedure, and if there are another alternative for them, then we'll make those recommendations. There's only really one condition where I will stop an owner when I'm outside walking down the beach or anything and I see a young overweight lab. A young overweight lab is really at risk for damaging their cruciate ligament. I'm not gonna go up to them and, kind of side rail them or anything like that. But if they stop and we're talking or anything like that, I will make mention of it in those cases because it is a major issue in this breed. So we want to keep those dogs underweight. We want their exercise to be regular but not over excessive. And again, we talked about the genetics, and the genetics do have a play that is out of our control, but labs, they should be kept underweight and they should not be marathon running dogs.